Do agents that increase insulin levels promote cancer? Numerous studies have identified an increased risk of cancer in type 2 diabetes. Boker explored the association between anti-diabetic therapies and cancer-related mortality in patients with type 2 diabetes, postulating that agents that increase insulin levels might promote cancer. Patients with type 2 diabetes exposed to sulfonylureas and exogenous insulin had a significantly increased risk of cancer-related mortality compared with patients exposed to metformin. It is uncertain whether this increased risk is related to a deleterious effect of sulfonylurea and insulin or a protective effect of metformin. I believe it is due to unmeasured effects of the underlying causes of cancer or risk factors with cancer. There is a list. Inflammation, oxidation reduction imbalances, exposure to toxins, acidic, hypoxic cell environments, etc. Diabetes and cancer. A consensus report was published in California Cancer J. Kling, 2010 July to August 60 to 207-21 by Giovannassai, et al. They looked at evidence that cancer incidence is associated with diabetes as well as certain diabetes risk factors and treatments. This consensus statement of experts assembled jointly by the American Diabetes Association and the American Cancer Society reviews the state of science concerning 1. The association between diabetes and cancer incidence or prognosis, 2. Risk factors common to both diabetes and cancer, 3. Possible biologic links between diabetes and cancer risk, and 4. Whether diabetes treatments influence the risk of cancer or cancer prognosis. Diabetes and pancreatic cancer in moles carcinog, 2012 Gen 51:6474 by Lee D. In this study they state that type 2 diabetes mellitus is likely the third modifiable risk factor for pancreatic cancer after cigarette smoking and obesity. Epidemiological investigations have found that long-term type 2 diabetes mellitus is associated with a 1.5-fold to 2.0-fold increase in the risk of pancreatic cancer. A causal relationship between diabetes and pancreatic cancer is also supported by findings from pre-diagnostic evaluations of glucose and insulin levels in prospective studies. Insulin resistance and associated hyperglycemia, hyperinsulinemia, and inflammation have been suggested to be the underlying mechanisms contributing to development of diabetes-associated pancreatic cancer. Signaling pathways that regulate the metabolic process also play important roles in cell proliferation and tumor growth. Use of the antidiabetic drug metformin has been associated with reduced risk of pancreatic cancer in diabetics and recognized as an anti-tumor agent with the potential to prevent and treat this cancer. New-onset diabetes may indicate subclinical pancreatic cancer. Patients with new-onset diabetes may constitute a population in whom pancreatic cancer can be detected early. Biomarkers that help define high-risk individuals for clinical screening for pancreatic cancer are urgently needed.